All right, guys, we're going to do scenario one really fast. So for scenario one, it says the patient suddenly reports a crushing chest pain radiating to his left arm. He states, I feel like something is sitting on my chest. Use proper hand hygiene and PPE. Respond to a myocardial infarction. Obtain vitals and complete a 12-week EKG. So for this one, we're going to pretend like Harold, our patient, Mr. Whitman, just started complaining about this. I have his vital signs here. So he's feeling very anxious. He's sweaty. He's clutching his chest. He's breathing quickly. So he's currently sitting up at a slight angle. We're going to start by laying him down so that we can get a 12-lead EKG on him. We'll say that maybe the nurse is in here with us, but we're going to help get vital signs on him, and then we're going to run a 12-lead EKG for him. So we're going to lay him completely flat because that's the only way that you guys can do an EKG is when we're laying completely flat. Don't forget there's a few exceptions to that. So if our patient is pregnant or anything like that, we would need to tilt them off to the side. Okay, so we have Harold here. We're going to start with our radial pulse and we're going to be counting our respiration. So remember, if I'm doing this on me, I'm feeling for that slight pulse that's in your arm. We're just going to pretend to do it. We're going to count his respirations, right? We know he's struggling a little bit here. So we're just going to kind of do our best. Harold, stay nice and calm. You're doing a great job. Take some deep breaths, stuff like that. Don't forget, if he doesn't know you, you need to introduce yourself. Hey, I'm Lindsay. I'm going to help you out a little bit today. I'm going to grab your arm. Like, obviously, if he's not responding, we're not going to is it okay if I touch you? And then we're going to wait for consent. We're going to assume that that's what he wants, right? So next I'm going to start running 12-lead EKG, everything like that. The scenario does say to do hand hygiene. So remember, for a 12-lead EKG, if there is no broken skin or anything like that, we can run a 12-lead EKG without gloves. But because the scenario says to do so, we're going to do it. So I hand sanitize, make sure it's all nice and dry. I'm going to grab my gloves. Grab my EKG machine. And we're just going to encourage our patient to stay nice and calm, stay still, stay laying down. It does say he's sweaty, he's having a hard time. So we're going to be patient with our dude here. Okay. Okay, so the main thing with these mannequins is their skin is super sticky. Our electrodes do not like to come off of their skin, so I'm gonna place it on his shirt. I know that that's not how we actually do it. Just it doesn't like to come off of the mannequin. So I'm gonna have my alcohol wipe. I wipe him all down. Anywhere a lead is gonna stick, that's where I need to wipe. So wipe, 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 clean off his chest. Okay. And then we're going to place our electrodes in the correct location. So I have right and left arms. I have right and left legs, and we're going to do those guys on his inside of his hip. And the reason that we're going to do it inside of his hip is so we can kind of get it done faster. So remember, you can do the arm on kind of where you would take the radial pulse, and you can do the legs down at his ankles. But for this purpose, we're just going to do it quickly. We're going to place all of our little baby electrodes. Okay. We are going to attach him to it. So don't forget, for these leads, we're going to lay them nice and flat on the bed here, so that they're all kind of pulling the same direction. So if I look at his leads up here, and I'll show you guys in a second, if I look at his leads up here, they're all facing the same direction so that we can make sure that it's not pulling different ways on his skin, okay? So we're going with, when it says right arm, left arm, we're going with the patient's right and left, not yours, the patient's, okay? So I have him all hooked up. Obviously, it's not going to register anything on here, but I would run my EKG, make sure that you put your information in it. And then once we're done with that, we're going to go ahead, print it all off, and then disconnect him from everything. Okay. On our scenario cards, those are the only things that we have to do for him. So we did the blood pressure, we did the hand hygiene, we did the radial pulse, we counted his respirations. You guys know how to do the blood pressure, and you guys know how to do the pulse oximetry. After this, don't forget, after I take everything off of him, I'm going to hand hygiene again. I'm going to take my gloves off and hand sanitize, and then I have to wipe everything down. I'm going to show you guys really fast what Harold looks like. So you see how all of my leads are facing the same direction. It's all clipped in, looks nice and beautiful. Okay. All right.